say you have a patient that has a tracheostomy that needs to be suctioned. Ms. Smith has got a tracheostomy placed and the doctor has ordered to do suctioning as needed. The doctor will never order how often to do it. It's up to the nurse's judgment. So you'll have to know when your patient needs to be suctioned. Did their O2 sats drop? Did they have a change in their breath sounds? So you'll have to assess your patient to determine whether or not they need to be suctioned. So we're going to go into the room and assess her patient to see if she needs some help with her airway. So, knock knock. Hey, Miss Smith, my name is Shelley. I'm going to be your nurse today. Can you tell me your name and date of birth? Okay. Well, it sounds like that you need some suctioning. I'm going to do privacy. Sounds like you're having some trouble breathing. I'm going to listen to you and see if your trach needs to be suctioned. Okay, I hear some wheezing up in your upper lobes, so I do think you need to be suctioned. Do you have any questions? Nope. Okay. I'm going to get my stuff ready. As you can see, Miss Smith has got a trach collar. This is like an oxygen mask, sort of like the ones you'd have over your mouth, but this is just going over her airway. So she has got her trach collar on. It's attached to her wall oxygen. I have got my suction machine. I've got my tube in here. I'm going to set it to where I can reach it. Whenever you suction a trach, you want to set your suction machine to between 80 and 120 millimeters of mercury. So we're going to set ours on 100, but it needs to be between 80 and 120 for it to be strong enough to suction the secretions out of her tracheostomy. So I've got it there. I'm going to let the pressure be building on it. I'm going to put down something to protect her gown, because sometimes when you suction you may pull out a large mucus plug and that would get on her gown and soil it. For safety, I'm going to pick her bed up for a workable height for me, so I don't have to bend down and protect my back. Her side rail is down for me. You don't want to try to reach over a side rail whenever you are dealing with someone's trach. And I'm going to lay her a little flat if she can tolerate it. If you have them setting straight up and you're doing your trach suctioning, when you pull that catheter out, it could scrape against their chest wall and contaminate it. So it's best if you can lay them a little flat if they can tolerate it. And she's doing good. Now I'm going to set up my equipment. I've already opened this once, so I'm going to have to do it again. But we're going to pretend this is a new packet. Whenever you look at your packet, how it comes, pay attention that there's a little box on the inside. You don't want to accidentally drop that when you open it. So I always flip it to where I can see it. Excuse me. This is a sterile normal saline that you can use. You can also use sterile water for suctioning your trach. So I'm going to open it away from me, and I'm going to get this out. Now here's my little box, and I'm going to pop it open. And as you can see, there's a little bag in there that we're going to fill with water. So we want to set it up. Now we cannot touch the inside because the inside is sterile. Actually, before I get my sterile gloves on, I'm going to go ahead and I'm going to pour my sterile normal saline. Now this was opened this morning at 7 o'clock, so it's still good. When I opened it, I set my cap upward. I'm going to lip it. Pour a little out to clean the lip. And I'm going to pour some in my little cup. Now when you're doing this sterile procedure, you want to be sure that you have cleaned off your bedside table. You don't want it to get wet. So our bedside table was clean. Now I'm going to open my gloves And these are not labeled left and right like those other ones are. So I'm going to open it. Remember that 1-inch border. Okay, so that first glove I'm going to pick up from the inside. I'm going to have to find my thumb. Put the first one on. Now I'm going to do the second one. Remember, 4 fingers under the cuff, thumb out. Hands up. There we go. Now inside of this is our suction catheter that we're going to use. This is the length of it. I'm going to kind of wrap it up around my hand here and show you something. This is what's going to attach to the suction here on the bed. This little nozzle here is what controls the suction. When your thumb is down, it will be applying suction. When your thumb is up, there's no suction on it. So this cannot touch anything. This has got to go right into the center of that trach. It cannot touch anything. It has to be sterile. So I'm going to loop it in my hand, and I'm fixing to contaminate one of my hands. I'm going to contaminate my non-dominant hand. So I'm going to pick up my tubing, and I'm going to connect it. And I've got to hit it right there and push it in. Okay, so it's in place. Now I need to test my suction. Now I'm going to do sound effects with this, so don't get tickled. When my thumb is down, it's going to make a sucking noise because it's going to suck on the suction machine. It's going to go, so that's my sucking noise. So thumbs down, it will suck. Thumbs up, it does not suck. So I'm going to test it to see if it works. So I'm going to stick it in. My suction works. This also lubricates the tip of my cannula. Again, I can touch to the inside. I cannot touch to the outside. So it's sucking, it's working. Now, I've got to get this mask off. So I'm going to use my pinky. I'm going to move this over. Thumbs up when you go down. You do not want your thumb down when you put this tube down. So thumbs up. And you're going to hit directly in the center. And you're going to thread it as far as it will go. With thumbs up, you can't touch down here because you will contaminate. So I'm going all the way down until I meet resistance or the patient starts to cough harshly, because this is going directly into their airway. Once you meet resistance or they start to cough harshly, you back up about 1/2 inch. Then you put your thumb down. And as you come out, you suction. So you suction for no longer than 10 seconds. With my dirty hand, I want to oxygenate them again. I'm going to clear my line because there was a lot of secretions in that. Clear my line. This tubing is good for 2 passes. You can use this twice as long as you do not contaminate it. You need to give them at least 30 seconds in between and let them get more oxygen. Now during this, you may notice your patient may be on a heart monitor, maybe their heart rate goes really high. You may just have to let them rest a second and then do it again. So I've given them 30 seconds. I'm going to move that out of the way. Thumbs up when you go down. I'm going to go down with it until the patient starts to cough or I meet resistance. Back out just a bit. Thumbs down. And kind of twirl it as I come down. Put it over. Now that was continuous suctioning because I had my thumb down the whole time. You can also do intermittent suctioning, and I'm going to show you. So thumbs up when you go down, because when you press on that, it is essentially taking the patient's breath. So whenever I suction, to be sure I'm not going any longer than 10 seconds, I'm counting, and I generally hold my breath while I'm doing it, because if I can't breathe, they can't breathe. So thumbs up when you go down. Go down as far as you can go. Again, I'm not contaminating. I'm not hitting anything. I'm only touching this catheter. I meet resistance. I back out just a little bit, and to do intermittent suction, I pick my thumb up and down. Again, no longer for 10 seconds. Put it over. Let me show you something else. Then, of course, I would be done. I would suction it out, clear my line, unhook this, wad this up in my glove and throw it away. Put this up, record how my patient did it. But how my patient tolerated. Let me put this back together. Let me show you how easy it is to contaminate. If I do this, I've contaminated because I've used my sterile hand. This hand cannot touch anything but this catheter. So let's say I do this and I hit the outside. I've contaminated. I, with good faith, cannot put this down in that patient's airway. You have to stop what you're doing and start over. Let's say I go down, thumbs up when I'm going down, and I'm coming out, and I'll put my thumb down in suction. Let's say that when I come up, I do that. I've contaminated it. I cannot do it again. I have to get a whole nother kit. Okay, so we're done. I'm going to unhook this, put it up here, turn my suction off. I'm going to put this catheter in my gloves, throw everything away. I'm going to clean up my area. I'm going to chart how the patient tolerated it. I'm going to chart what kind of mucus I got out. Of course, I can't measure exactly, but I could say, was it a lot? Was it a heavy amount? Was it copious amount? Was it a scant amount of clear, frothy sputum? Was it yellow? Was it green? But to be sure that it worked, I need to listen to their lung sounds again. You sound much better, Miss Smith. Okay. Now I'm going to pick her head of the bed up for comfort. I'm going to lower it in a low position. I'm going to be sure her side rails are up, her call light is in reach, her bedside table is in reach, and I'm going to wash my hands and exit and document.